Director of HP Sustainability and Social Innovation Team, Mr. Paul Ellingstad.
Hi, good morning, everyone. I've got the easy job. I've just got an introduction. What makes it hard, though, is that it's one of the most inspiring leaders that you could ever meet that's here today. I just want to start, though, by thanking everyone. You know, it's a Saturday morning, 1,200 people ostensibly working here on the weekend. I talked to my daughter this morning. She's 6. She says, "Dad, why are you working on a Saturday? You should be here at my swimming lessons." I said, well, you know, if you love what you're doing, as the saying goes, if you love what you're doing, you'll never work another day in your life. And I think that probably most people in this room, if not everyone, feels the same way that I do, that what we're doing, it's not an obligation, it's not a job, it's not anything that we don't just absolutely love that we're doing. So thank you for that commitment that you're making, not only to be here and to share with your fellow leaders, but that energy and that enthusiasm that you take back and spread to your communities, to your networks of friends and colleagues every day of the year and years on end. So thank you for that. When I think about why I'm here, I feel that at HP, we're really standing on the shoulders of giants. Our founders, Bill and Dave, back when they started the company in 1939, were talking about the moral obligation that companies have and that employees have to be contributing to society, not just to be making a profit. And that's something that's lived on. It's been the DNA in the culture of the company since 1939. And that legacy today is part of what drives me and my team and my colleagues on to partner with other companies, with student organizations, with NGOs, with governments, not to come up with the answers and the solutions and take the credit and say, look at all these great things that we're doing, but to genuinely partner. Because fundamentally we believe, as our founders did, that we can achieve so much more together, coming up with more creative, more innovative, better, sustainable solutions by working together. And that's what we're all about, and I know that that's what you're all about as well. We've had the honor and the privilege, as I said, building on this legacy, and it's a real privilege to be able to work in the area that we do. But another part of that honor is actually the partners that we get to work with as well. And it's been an absolute honor to be working with Paul Farmer's organization, with Partners in Health, for the last 2 years, as we've built up our programming and our support for health programs, as well as the work that we do in education and environment. And so it's my deep and profound honor to introduce to you someone who I could go on for 20 minutes, maybe 2 hours, in terms of his accomplishments, his accolades, but I think it's much better to hear from the man himself, the inspiration, Dr. Paul Farmer. Thank you.
Thank you. Thank you. Thank you very much. It's a thrill to be here, and I'm glad I got to speak with you a little bit in the morning as you filed in. I received very specific instructions. How come the lights are all on me and not on you guys? I received some very specific instructions from the people who've been organizing this for some time, and I'd like to share them with you. And I was a little bit taken aback when I read them, so I called Sam on the phone and said, Sam, well, you know, this is, of course, the night before the conference. He sees my number pop up, and he thinks he's going to cancel. Didn't you, Sam? Where is Sam? He's probably, isn't that just what you thought? Yeah. Oh, ye of little faith. But I wanted to make sure that I got the message right. And because I'm here as a part of a long-term accompagnateur. And I'll go back to that word. What does accompagnateur mean? The obvious, to accompany MCN to accompany the people in this room, just as I've been accompanied. And you heard Paul talk about partnership, and those are going to be two of the things I talk about most. But may I read the instructions? Specifically, we would be very interested to hear from Dr. Farmer critically reflecting on the way students engage in international development efforts. Many of our students are searching for ways to turn their interest in service into a commitment to social justice, extending beyond their college years. Now here I wanted to edit, okay? The grammar, yes, Sam. But also, it's my assumption that everybody here is interested in extending this beyond your college years, that you do not see this as a short-term engagement. And then there's more. It would be interesting for Dr. Farmer to reflect on this in relation to the issues facing poor communities around the globe perpetuated by structural violence, which is kind of a heavy term, but I will return to it. I think it's important that we understand that some of the things that we can see in our everyday life and practice, for example, a patient who's sick, an example I gave earlier of someone with malaria who's having rigors. It's not that difficult to figure out either the problem or what should be done. But why do we have persistent malaria and hundreds of thousands of cases now, decades after discovering how, and more than decades, about discovering how to prevent and to treat malaria? So those are structural considerations that are far beyond the work that we address as direct providers or as usually as activists in the field. That's an important question. And then I won't read it all. It does go on and on, my list of instructions. You should be sorry, and I shall make you pay for it later. But there's another little subset, volume 2 of the instructions, if you will, which says, students are very interested in personal narratives and love to learn about personal aspects of leaders in the field. What personally motivates you? What values center you and keep you constantly pursuing justice? I suppose you mean that when I'm not busy watching, say, Game of Thrones or something. What unexpected obstacles have you encountered? And another question is, where do you see hope? So I'm asked to do all these things in what is now 18 minutes. But I'm going to give it a try. And I'm going to start, and I see that I'm not the first one to think how important it is in a meeting like this where there are 1,200 students. It's important for us to talk about some of the failures we've known, not just the successes. Or maybe it's more important to talk about the failures we've known and not the successes. I went to Duke University, and I started college in 1978. And I'd rarely been away from home in Florida. And even though, yes, I will ask, I mean, the personal narrative stuff gets kind of old after a while. Even though I lived, yes, it's true, in a bus, meaning with wheels. So he would say, you rarely left home because your home rarely sat in one place. So on a technicality, I rarely left home, even though we moved around a lot. And I really didn't, I thought I knew a lot about the world. I was a real bookworm, but I didn't know much of anything about the world. And to tell you the truth, it was really going to a university that opened my eyes. So here I am in all places in the middle of a forest. How many of you have ever been to Duke? I assume that's some sort of affirmation, whoop. She likes Duke in any case. But it's in the middle of a forest, am I right? Come on, just say, yes, Paul, you're right. And that there I learned about so much about the world. And I learned about the world really, again, through books, but this time with accompaniment. I'm not saying that my high school teachers didn't accompany us. They did. Now I understand just how much. But being in a seminar, for example, with a half dozen other people my age and a teacher who had great expertise in that particular field, and we had hours and hours to read about problems that were of interest to me. My interest changed over those 4 years. But it was a wonderful experience, and it sounds so old school and so professorial that I'm kind of embarrassed, but it's true. In fact, just to go back to one experience in class, I took a class called Medical Anthropology. Now, why did I take that class? Because I was a pre-med biochemistry major, and I thought, it's got the word medical in it, I'll take it. I took medical ethics, I'd take medical anything. And I was very much a science nerd, had thick glasses, was on the basketball team at Duke that year. I actually said that once at Duke. And they were interviewing me in this big auditorium. I said, well, my best year was when I took the team to the ACC and we won. And there's a little pause and then a very little pause. Anyway, so I was a science nerd, real shock, and I took this class, and you had to do work in the field. What was the field? I didn't know what the field was. And I went into the Duke University emergency room and looked at how race, class, and gender influence utilization rates. Again, a fully accompanied kind of experience. I had a teacher and I had a teaching fellow. I had two teachers and a teaching fellow who was herself a physician, the teaching fellow and anthropologist. And it really was an illuminating experience for me. And I almost left that class thinking, this is how the world works. And then I met in the emergency room a couple of Haitians who they'd been farm workers and had injuries. I forget what their injuries were. They were minor and really not related to their work. But they didn't have they didn't have health insurance. They didn't have medical care. So they ended up in a university emergency room. And, someone may have said, does anybody speak French? We need a translator. And of course I said, in my earnest way, oh yes, I speak French. And we couldn't understand a word. I couldn't understand a word they were saying, and vice versa. Because Haitians, it turns out, have their own language, as many of you know. And I should have known, but I didn't know. And then after that, I got interested in migrant farm workers. And I ended up doing what any of you could do, which was going to write, this time for a newspaper. I was at Duke, and I was telling this story not too long ago. One of my Harvard medical students, she has twin brothers who both went to Duke. And she's now a physician too. But I went and I said I'd done this, and they later found the article that I wrote. In 1981, I think. It was called, guess what? Haitians Without a Home. So here we are in 2012, 31 years later, and I'm telling you that I got interested in this work because of a class I took at Duke University, and here I am 31 years later. Because the article that I wrote led me to be interested in Haiti, but I'd already wanted to go to Africa. Here's another story that I'll tell you. So it didn't occur to me that I might apply for a Fulbright and get turned down. And, I was thought, well, I have great grades, and I'm so smart and compelling and handsome and a great basketball player. And, my list of attributes is without end. So I applied for a Fulbright in Senegal. And I wrote to a professor there. And the first sign that things were not going to go well was when I got a letter back in beautiful French from another professor who said, I'm so sorry, our colleague died many years ago. So that was a bad sign. And I didn't get the Fulbright, got turned down. And plan B was to go to Haiti, but I didn't have a plan. I didn't have a place to go. I didn't have any money. My parents didn't have any money. And I had a research fellowship to go to a lab, and I went to that lab, and but what I really wanted to do was go to Senegal or Haiti. And when I was working in the lab, I met someone whose last name, this is a professor at this university, not Duke, but another one, and I met someone who was an anthropologist, a medical anthropologist, who'd worked in Haiti. And I told him I wanted to go to a specific hospital, and I named it. And he said, oh, I grew up there. My mother runs the place. And once again, it didn't occur to me that they might not want me to work at their hospital. So off I go to Haiti, full of beans. I had about $600 in my pocket. And 1 year, I had decided that I would spend at least 1 year before I went to medical school. And then, of course, I hadn't applied to medical school, mind you, but that was the way things. And that's another thing I want you to remember is don't let these defeats dampen your spirits. They didn't dampen mine. So I went to Haiti with my $600, and I went to the hospital where it didn't occur to me they might not need me, and that their hospital would not fall apart if I weren't with them. And they turned me down. So here I am in Haiti. Now I have about $575. in spite of my judicious management of food, which led me to get various gastrointestinal diseases. And all I can say is a good thing cholera wasn't there back then. And I got no job. No, I can't say I have no friends, because that wasn't true, but none that could help me do what I wanted to do, was work in a hospital and learn how to be a doctor. And sometimes you can call that what we call in Partners in Health shorthand, QPE, the quest for personal efficacy. And you can mock it, as I have in error. You can make fun of young people and the way they have this drive to do the things they want to do. Or you can say, this is something to be harnessed and used. And, to make a long story short, which isn't my strong suit, I should be done, Sam, in about an hour and a half. Of course, things worked out, right? I found other people to work with. I found a Haitian team. They didn't have a hospital. They had a clinic. And in 1983, 28 years ago or more, several things happened in that year. First of all, I met Ophelia Dahl, and we're now celebrating the 25th year of Partners in Health's founding. Same year when I came up, yeah. Same year, I got an interview at Harvard Medical School, and it did not occur to me that I might not get into Harvard Medical School. Don't worry, I did. But I didn't even apply to a second medical school. And see, in spite of those defeats, I wasn't overly confident, but I thought, hey, if I don't get into Harvard Medical School, I'll apply to another one next year in Florida. And surely they'll take me back to Florida. But I did. I came up here and I met, guess who, on my interview? Jim Kim. Same year, I met the Haitians I work with to this day. I met Jim Kim through Arthur Kleinman, who would become my mentor at Harvard. It's a long story of connections, but also a story, I think, of understanding how to persevere. And I said earlier to many of you that the two biggest ingredients for the kind of work you want to do, which is make the world a better place by addressing extreme poverty, probably the two most important ingredients are perseverance and humility, and the most important strategy for advancing this work is partnership. That's what the key. You just don't do anything alone, and you don't do anything as a small group either. You have to build partnerships. So a little bit about Mirebalais, to tell you another story of defeat, but a very productive one. In Mirebalais, I went into this clinic, and there was one doctor, a Haitian doctor, who was a brilliant guy. I haven't really written about this. After all these years, I'm just now starting to try and write about it. So this is the way it looked. It was small, it was crowded, it was hot. And there was a huge line of people outdoors. There was one doctor, and I was taking vital signs. I'm the world's best blood drawer and vital sign taker you ever did see. Let's just say, too bad that wasn't required at Harvard Med School. And then we had a pharmacist who was not a pharmacist at all. She wasn't trained in pharmacy, and she would have these jugs of medicines, literally jugs. Some would have poisonous medications for scabies in them, and right next to it would be something for stomach cramps. They were of dubious value, if you ask me. But that was it, and then we'd see sometimes hundreds of people in a day. And it was hard work, and it was hot in there, but that's not the real problem. The real problem is at the end of almost a year, we had to ask, have we really done anything for these people? They were charged a fee to come in and see this harried and hassled doctor and then get poured into some corncob stoppered bottle a medicine that wasn't quality assured, it came from a local Haitian pharmaceutical manufacturer, which later, by the way, with that same company, would get in big trouble because they had the wrong ingredient in a Tylenol brand, acetaminophen, and I think something like 60 children died after renal failure. Just, again, nothing like that happened in that year, 1983, but that was the year of living dangerously in many ways. Not for me. Because then, at the end of that year, I went to Harvard Medical School. Now, a social justice approach does not let that be over, right? I'm not saying that those of you who have gone off somewhere and are now back need to go back to that same place. I did. It was good for me. It's been hard, It was the right thing to do for me. It might not be the right thing to do for you. What I knew in 1984 was that my work wasn't over and that it couldn't be my work. It had to be our work. Obviously, the Haitians I worked with. And we stuck it out. And in the same group of people that started that project in Haiti, met in Haiti and at Harvard in 1983, we founded the next couple of years Partners in Health. And Partners in Health grew across Haiti. We abandoned our work in Mirebalais, which wasn't good work, and went off to start again in a squatter settlement not too far away, a place called Conge. And many of you have been there, or some of you have been there. And that work, which was better but still not good enough, led to the establishment of a chain of hospitals focused on the needs of poor people, and now is about 5,000 people, all of them Haitian, most of them Haitian working there. And I'm happy to tell you that in about a month, we will complete the largest post-earthquake medical center in Haiti in the town of Mirebalais. So very excited about that. And back to partnerships. So Paul, who introduced me, Hewlett-Packard's been one of our partners. We had partners we never would have expected. I just came from dedicating a cancer hospital in in Rwanda. Probably rural Africa's first cancer hospital. Rwanda, plenty of cancer, 0 oncologists. This year, we not only dedicated a cancer center, a guy who gave us the money is a NASCAR driver. Now, if my youngest son thought that was the coolest thing ever, that the guy from Cars was going to give us the money. But if someone would have said to me 20 years ago, will your partners include NASCAR drivers as you approach cancer in Africa, I would have said, that sounds improbable. But that's the thing about partnerships. Some of them are completely to be expected, but many are improbable. And this hospital in Haiti that I just mentioned is probably now the largest solar-powered hospital in the developing world, period. It's green. It's different from what we would have built 10 years ago. It's through partnerships. The person who helped us, one of the people who helped us move forward, this is another part of the defeats of this work. The person who helped us move this forward, the solarization of our facilities, and Partners in Health now runs 75 hospitals in the world today, in Africa and in Latin America predominantly, all for poor people. Thank you. It's hard to run hospitals. One man who helped us do this was a master implementer named Walt Rademan. He was Solar Guy. That's why I always called him Solar Guy. He went to Rwanda, taught the Rwandese how to do it, how to maintain these things. He went to Burundi. He went to Lesotho. I said, Lesotho, it's really, really isolated. It's really hard. He just looked at me and scoffed, as if to say, you have no idea how tough I am. And he had no trouble. He said, go to the middle of the Amazon forest and put up a solar center, and I'll then talk to me. But he lost his life in the earthquake in Haiti because he was there where we asked him to be to help us in Haiti. And he died in the earthquake, along with many other people, including friends and colleagues, of course. You can't plan ahead for every defeat. You can't anticipate the minor setbacks or the major ones. But you can build partnerships, and you can build teams, and you can build friendships that can allow you to move forward difficult work. And that's what I wish for all of you in this room today. I'm going to give an example and close by telling you about a partnership, a Partners in Health partnership. And I'm going to ask you to do me a favor. I knew some years ago that we were not going to expand our mission or meet our goals, which are social justice goals to link high-quality medical care, including medical centers like the ones I work in here in Boston, like the Brigham and Women's Hospital, to link that quality of tertiary care medicine to proper community-based care, and also to move that to some of the poorest places in the world. And you've heard, I know, of some of the places we work, and some of you have worked with us. I mean, there are people here from Face AIDS. Yes, Face AIDS. They're always whooping. They also, in addition to whooping and dancing, Face AIDS has raised $2.5 million for our work in Rwanda, which is an amazing fraction of our budget. There are people from GlobeMed. They whoop less virulently. There are people from, I think, from Global Health Corps. Again, I don't know what we'd have done without their resourcefulness and the way they put together Global Health Corps, a small organization, but very deep, if I may. And I can't go through the list because the list is long, but I do want to mention one other one, NIAIA. Anybody? I'm glad you're here because the favor has to do with this organization. The organization was not founded by me or any of my students. They are my students now, but by a group of students from another lesser university, which I won't mention by name, but which is in New Haven, Connecticut. And they had gone to Western Nepal, and then they would always go on about the far west. And I said, what is this, a spaghetti Western? All right already, it's far, but far from what? And then I went there. It is far. I feel like it's the farthest I've ever been, anywhere. And they're working, here's what they did, and it's a group of people who I'm proud of, and again, many of them are now my trainees at the Brigham. They're physicians, they're infectious disease fellows between the Brigham and Mass General. It's a great group of people, and of course, the great majority of them are Nepali. And what they did was what we had learned to do in our failures. We'd grown big as an NGO, but we'd let the public health system collapse in Haiti. And about 10 or 15 years ago, we said, that's not the right model. We don't want to privatize all goodness. Harvard and Hewlett-Packard and Face AIDS are not going to confer rights for the Nepali or Haitian or American poor. We have to preserve our ability to preserve the notion of rights, the right to health care, the right to education. And I would say, if we had the right to water in Haiti, we would not have the largest cholera epidemic in the world today in Haiti. So this model of building partnerships and designing them deliberately when possible to support the public sector is what NIAIA did. They took over an abandoned hospital in an area mired in conflict in the Civil War, and they reopened it with Nepali staff and with a lot of people who come from one place to the other, that is, say, Boston, New York, over there to help. I went there and had a great time because I spent a lot of time seeing patients. Although I had this image of working in Nepal in the beautiful mountains, cool, fresh, far away from like the lowlands where I work. And it was about 110 degrees every day that I was there. And I was just begging for it to rain. It wasn't comfortable. It was hard work, a lot of patience, but a great enthusiasm and ideas about how to run the place, not necessarily the clinical ideas, but about how to raise the money, how to engage donors. They were revolutionary in many ways. A focus on transparency, on following the resources. So here's the favor I want to ask you to do, and I'd like to invite Mark Arnoldi up here for a second. Come on up, Mark. Sam described Mark as approvingly as a young adult, and some of the Nepalis, one of them called him and they said, "Hey, you look like a hero." And I said, "What, like an action hero?" They said, "Yes." Hey, Mark. But NIAIA is a finalist in something that Chase Community Giving, I believe it's called. And here's my request: just get the name right. What is it called?
Chase Community Giving.
Oh,
Contest.
see, there I have it. I don't need Mark at all.
Went to Harvard.
I hope that on the way out the door, you'll pick up some kind of form that allows you to vote through your mysterious social media, which I don't fully understand. Twitter, what is Twitter? Anyway, Twitter away. The thing that I like, it's like going to Face AIDS and they say, well, I said, how do you raise so much money for Partners in Health in Rwanda? And they said, we had a dance-a-thon. I said, how does that raise money, dancing? Well, I still don't understand the mysteries of dance-a-thons, but the check did arrive. So I'm going to ask you, first of all, to meet Mark and the NIAIA folks who are here and help them. This would be the largest gift that they'd ever received. And I want to say in front of everyone here that this organization and several others in this Praxis network, that are affiliated with Partners in Health can count on us old grandpas who've been doing this for 25 years to help move this work forward. Why? Because we believe that MCN and the network are really not only our retirement plans, but why we will see less dis-ease and more health and more social justice in the future. Thank you so much for including me and looking forward to today. Thank you.